Did you know prostate cancer is the second most common cancer in men after skin cancer? Statistics reveal that 1 in 8 men will face this diagnosis at some point in their lives. In 2024 alone, more than 300,000 men in the United States were newly diagnosed, and over 30,000 tragically lost their lives. Yet here's the hopeful truth. When caught early, prostate cancer is highly treatable, with survival rates soaring above 95%. The danger lies in its silence. In its earliest stages, prostate cancer often produces vague or easily ignored symptoms. Symptoms many men mistake for normal aging or minor health issues. That delay can make the difference between life and death. In this video, we'll uncover the 10 critical early warning signs you must not ignore. By learning to recognize them, you'll be empowered to act swiftly, protect your health, and possibly save a life. Sign number 1, painful or burning urination. One of the earliest and most alarming warning signs of prostate cancer is painful or burning urination. While it may sound like a minor inconvenience, this symptom can signal a serious underlying condition when it persists or recurs. So what's happening inside the body? As the prostate gland enlarges due to cancer, it begins to press against and partially block the urethra, the narrow tube that carries urine from the bladder out of the body. This obstruction not only slows urine flow, but also creates pressure on the bladder and irritation along the urinary tract. The result is a sharp burning sensation or persistent discomfort each time you urinate. Some men even confuse this with a urinary tract infection, UTI, unlike a simple infection that clears with antibiotics. Burning urination caused by prostate cancer does not go away and often worsens with time. Risk factors make this warning sign even more concerning. Men with a family history of prostate cancer, those who are overweight or obese, smokers, or those with a history of chronic prostatitis are at higher risk of experiencing urinary symptoms linked to cancer rather than infection. If you fall into any of these categories, it's essential to pay close attention to changes in your urination patterns. Doctors typically begin the diagnostic process with a PSA blood test to check prostate-specific antigen levels, followed by a digital rectal exam, DRE, to feel for abnormalities in the prostate. A urine analysis can rule out infections, and in some cases, a cystoscopy, a direct look into the urinary tract, may be recommended for a clearer assessment. When prostate cancer is confirmed as the underlying cause, treatment options vary depending on the stage of the disease. For localized cases, surgery to remove the prostate or targeted radiation therapy may be effective. In more advanced cases, hormone therapy can help shrink or slow the growth of cancer. Importantly, antibiotics alone will not resolve the issue if cancer is the cause. Recurring painful urination is never something to dismiss. If you experience it more than once, or it lingers after standard treatment, consult a healthcare professional immediately. Early action could be life-saving. Sign number 2, frequent nighttime urination, Nocturia. Do you wake up multiple times each night to rush to the bathroom? While many men chalk this up to aging or drinking too much water in the evening, frequent nighttime urination, known as Nocturia, can be an early sign of prostate cancer. This repeated interruption of sleep doesn't just leave you tired. It weakens immunity, increases daytime fatigue, and can have a serious impact on heart and brain health over time. When the prostate enlarges due to cancer, it presses directly on the bladder and reduces its capacity to hold urine. The bladder becomes more sensitive and triggers frequent urges even when it's only partially full. Over weeks and months, this constant bladder irritation forces men out of bed 2, 3, or more times each night, something that should never be ignored. Risk factors make nocturia even more concerning. Men over age 50, those who are overweight, follow a high-salt diet, or have diabetes are more likely to develop urinary problems. In these individuals, nocturia may not just be a symptom of lifestyle. It could point to prostate cancer silently growing. Doctors may begin the diagnosis process with a bladder diary, where you record how often you wake up at night and how much urine you pass. A PSA blood test is often ordered to check for abnormal prostate activity, and an ultrasound may be used to measure prostate size and evaluate how much it is obstructing bladder function. Treatment depends on the root cause. If the symptom is linked to early prostate cancer, options include surgery to remove part or all of the prostate, or radiation therapy to shrink the tumor. In some cases, medications or hormone therapy may be prescribed. Lifestyle measures like limiting evening fluid intake, reducing salt, and managing diabetes can also provide partial relief, but they do not address cancer itself. Frequent nighttime urination that disrupts sleep is not normal for men, especially if it becomes persistent. If you're waking up often at night, talk to your doctor immediately. Early detection of prostate cancer can make the difference between temporary inconvenience and life-saving treatment. Sign number 3, blood in urine, hematuria. Seeing blood in your urine can be shocking, and it should never be ignored. Known medically as hematuria, this symptom may look like pink, reddish, or cola-colored urine, and in some cases, the blood is microscopic and detectable only through lab tests. While infections, kidney stones, or injuries can also cause hematuria, prostate cancer is a serious underlying possibility that must be ruled out. Why does this happen? As prostate cancer progresses, the tumor can invade nearby structures like the bladder, urethra, or kidneys. This invasion damages delicate blood vessels, allowing blood to leak into urine. Sometimes, the bleeding is intermittent, leading men to believe it's gone away, when in reality, the disease may be advancing silently. Risk factors increase the likelihood that blood in the urine is cancer-related. Men over 50, those with a family history of prostate or bladder cancer, long-term smokers, and individuals with obesity are at higher risk. In these groups, hematuria should be treated as a red flag, not a minor inconvenience. For diagnosis, doctors usually start with a urinalysis to confirm the presence of blood and check for infection. If infection is ruled out, further evaluation may include cystoscopy, where a small camera is inserted into the bladder to visualize any abnormalities. Advanced imaging like MRI or CT scans helps detect tumor spread, while a PSA test and biopsy can confirm whether the bleeding is linked to prostate cancer. Treatment depends on the cancer stage. If prostate cancer is confirmed, surgery, such as prostatectomy or targeted radiation therapy, may be recommended to remove or shrink the tumor and stop the bleeding. In cases where cancer has spread, systemic treatments like hormone therapy or chemotherapy may be necessary. Importantly, antibiotics or home remedies will not solve bleeding caused by a tumor. Blood in your urine is never normal, whether it happens once or repeatedly. If you notice even a trace of red or pink discoloration, consult your doctor without delay. Early investigation could mean the difference between catching prostate cancer early or facing it when it's much harder to treat. Sign number 4, persistent pain in back, hips, or legs. Hips or legs as a normal part of aging, arthritis, or an old injury. But when that pain lingers without clear cause or grows worse over time, it could be a sign of something far more serious: prostate cancer that has spread to the bones. Why does this happen? In advanced stages, prostate cancer cells can break away from the primary tumor and travel through the bloodstream, settling in the bones. The spine, hips, and upper legs are common sites for this spread. known as bone metastasis. As the cancer damages bone tissue, men may feel a deep, dull ache or sharp, radiating pain. In some cases, weakness, stiffness, or even numbness in the legs can develop if the spinal cord or nerves are compressed. Risk factors heighten the urgency of this warning sign. Men with untreated or advanced prostate cancer, those who delayed screening, or individuals with a family history of aggressive cancer are at greater risk. Obesity and poor lifestyle habits can also worsen bone involvement, making symptoms appear earlier or more severely. For diagnosis, doctors will first take a thorough medical history and conduct a physical exam. Imaging tests such as X-rays, bone scans, MRI, or CT scans are commonly used to detect bone metastasis. Elevated levels of PSA in blood tests may also suggest cancer spread. In some cases, a biopsy of affected bone tissue is performed to confirm the cause. Treatment focuses both on managing the cancer and relieving pain. Radiation therapy can target painful bone lesions, while surgery may stabilize bones at risk of fracture. Hormone therapy is often used to slow or stop cancer growth, and medications like bisphosphonates or denosumab help strengthen bones and reduce pain. Pain management through medications and physiotherapy also plays an important role in maintaining quality of life. Unexplained, persistent pain in your back, hips, or legs should never be ignored. It may not be arthritis. It may be your body's way of signaling prostate cancer progression. Early medical evaluation is crucial to prevent complications and protect your mobility and health. Sign number 5. Sudden, unexplained weight loss. Most people welcome weight loss, especially if they haven't changed their diet or exercise routine. But when the pounds drop off suddenly and without effort, it can be a dangerous warning sign. Sudden, unexplained weight loss is often linked to serious health conditions, including prostate cancer. Cancer cells are energy hungry. As they grow and spread, they hijack the body's metabolism, consuming calories at a rapid rate. This disrupts normal nutrient absorption and leads to muscle wasting, fatigue, and loss of appetite. In prostate cancer, unexplained weight loss is often a signal that the disease has advanced beyond the prostate and is affecting other systems in the body. Risk factors that make this symptom more alarming include older age, 50 and older, a family history of prostate or other cancers, obesity, which increases the chance of aggressive disease, and poor diet or sedentary lifestyle. In men with these risks, unexplained weight loss should trigger immediate medical evaluation. For diagnosis, doctors typically start with a complete physical exam and order blood tests, including PSA levels and metabolic panels, to look for abnormalities. Imaging studies like CT scans, MRI, or PET scans may be used to determine whether the cancer has spread. In cases of severe or rapid weight loss, additional testing may be performed to rule out other causes such as thyroid disorders or gastrointestinal disease. Treatment depends on whether prostate cancer is confirmed as the cause. If localized, surgery or radiation therapy may eliminate the tumor and restore normal metabolism. In advanced cases, hormone therapy or chemotherapy may be necessary to control disease spread. Supportive measures such as nutritional counseling, supplements, and exercise therapy are often recommended to help rebuild strength and improve quality of life. Sudden weight loss is not a sign of good health. It's a potential red flag of serious disease. If you're losing more than 5% of your body weight over 6 months without trying, it's time to see your doctor. Detecting prostate cancer at this stage can make the difference between early control and late-stage complications. Sign number 6. Rectal pain or bowel changes. Many men assume that rectal pain, constipation, or bowel changes are due to diet, hemorrhoids, or aging. But when these symptoms persist, they may indicate something far more serious: prostate cancer spreading into the rectum or surrounding tissues. The prostate is located just in front of the rectum. When cancer grows, it can push against or directly invade the rectal wall. This pressure disrupts normal bowel function, leading to pain, constipation, diarrhea, excessive gas, or even incontinence. In advanced cases, partial bowel blockages can occur, making it difficult or painful to pass stool. These symptoms are often misdiagnosed as gastrointestinal issues, delaying the proper diagnosis. Risk factors increase the likelihood that rectal symptoms are tied to prostate cancer. Men over age 50, those with a family history of prostate or colorectal cancer, and individuals who are African American are at higher risk. Obesity and smoking may also increase the chance of aggressive tumor growth, making bowel complications more likely. For diagnosis, doctors often begin with a digital rectal exam, DRE, to check for abnormalities in both the prostate and rectum. A PSA blood test is typically ordered, and if results are concerning, further tests such as transrectal ultrasound, MRI, or CT scans may be performed to visualize tumor growth. In cases with severe rectal symptoms, a colonoscopy may also be used to rule out colon cancer and confirm the source of the problem. Treatment depends on the stage and extent of the disease. For localized prostate cancer pressing into the rectum, surgery or targeted radiation therapy can relieve pressure and stop cancer progression. In advanced cases, hormone therapy or chemotherapy may be used to control spread and reduce symptoms. Supportive treatments like dietary adjustments, stool softeners, or pain management may also help ease discomfort. Rectal pain or unexplained bowel changes should never be ignored. What seems like a common digestive issue may actually be your body signaling prostate cancer. Getting checked early can not only bring relief, but also catch the disease before it spreads further. Sign number 7, pain while sitting. Sitting should be a restful activity, yet some men experience persistent pain or discomfort in the pelvic area, especially when seated on hard surfaces. While this may be mistaken for muscle strain, sciatica, or hemorrhoids, it can also be a warning sign of prostate cancer. The prostate lies deep within the pelvis, just below the bladder. When prostate cancer causes the gland to enlarge or tumors to grow, it can exert pressure on nearby nerves, muscles, and tissues. This pressure often worsens when sitting, particularly for long periods or on firm chairs. In some cases, men may also feel numbness, tingling, or aching in the lower back, buttocks, or perineum, the area between the scrotum and rectum. Risk factors raise the concern further. Men over 50, those who are obese, or with a family history of prostate cancer should be especially alert if pelvic pain develops. A sedentary lifestyle or chronic prostatitis can also make sitting-related discomfort worse. But when pain persists despite rest or lifestyle changes, cancer must be considered. For diagnosis, physicians may start with a digital rectal exam, DRE, to check for prostate enlargement or irregularities. A PSA blood test is a crucial next step to identify abnormal prostate activity. If results are concerning, imaging tools like MRI or transrectal ultrasound provide detailed views of the prostate and surrounding structures. In some cases, a biopsy is performed to confirm whether cancer is the root cause. Treatment depends on disease progression. For localized cancer, surgery or radiation therapy may relieve pelvic pressure and resolve sitting pain. Advanced stages may require hormone therapy or chemotherapy to shrink tumors and reduce discomfort. Pain management, lifestyle changes, and physical therapy may also be recommended to improve daily comfort. If sitting causes unusual or persistent pain in your pelvic region, do not dismiss it as routine aging. This could be your body signaling prostate cancer. Early medical attention can identify the cause, and if cancer is present, ensure treatment begins before it progresses further. Sign number 8, difficulty urinating, weak stream, retention. One of the most common and frustrating early signs of prostate cancer is difficulty urinating, struggling to start, maintain, or fully empty the bladder. Many men assume this is simply a part of aging or benign prostate enlargement, but when it persists or worsens, it may point to prostate cancer. Why does this happen? As cancer grows inside the prostate, it compresses or obstructs the urethra, the narrow tube that carries urine from the bladder out of the body. This blockage can cause a weak or interrupted urine stream, dribbling at the end, or the sensation that the bladder never empties completely. In severe cases, urine retention may occur, which is both painful and dangerous, as it increases the risk of infection and kidney damage. Risk factors that make this symptom more concerning include being over 50 years old, having a family history of prostate cancer, being overweight or obese, or having long-term urinary problems. Men who smoke or consume high-fat diets are also at higher risk for aggressive prostate tumors that cause significant urinary obstruction. For diagnosis, doctors often begin with a PSA blood test and digital rectal exam, DRE, to check for abnormalities in the prostate. A uroflow test can measure how quickly urine passes, while an ultrasound can assess both prostate size and whether the bladder is emptying properly. If cancer is suspected, further imaging, such as MRI or a biopsy, may be recommended for confirmation. Treatment depends on the cause and stage of disease. For prostate cancer, surgery, prostatectomy, or radiation therapy may remove or shrink the tumor, restoring normal urine flow. In advanced cases, hormone therapy or chemotherapy can help reduce obstruction by slowing cancer growth. In emergencies, temporary catheterization may be required to relieve retention until definitive treatment is provided. A weak urine stream or difficulty urinating is not simply getting older. It may be one of the first signals of prostate cancer. If you notice ongoing urinary struggles, seek medical attention immediately. Early action can restore your comfort and may save your life. Sign number 9, loss of bladder control, incontinence. For many men, loss of bladder control or urinary incontinence is embarrassing and disruptive. While it is sometimes blamed on aging or past prostate surgery, it can also be a red flag for prostate cancer. The prostate plays an important role in regulating urine flow. When cancer enlarges the gland or invades nearby nerves and muscles, it can weaken the urinary sphincter and interfere with bladder control. Men may experience frequent leaks, sudden urgency, or difficulty holding urine. In advanced cases, cancer spreading into the bladder can make incontinence more severe. Risk factors amplify concern when incontinence develops. Men over age 50, those who are obese, have a family history of prostate cancer, or have had chronic urinary problems are at higher risk. Previous prostate treatments, like surgery or radiation, may also increase vulnerability. But when symptoms arise suddenly or worsen, cancer must be considered. For diagnosis, doctors may begin with a medical history and symptom diary, noting how often leaks occur and under what circumstances. A PSA blood test and digital rectal exam, DRE, are standard first steps. Additional tests, such as urodynamic studies, evaluate how the bladder and urethra store and release urine. Ultrasound or MRI may reveal whether the prostate is enlarged or if a tumor is pressing on bladder structures. If cancer is suspected, a biopsy is performed for confirmation. Treatment depends on the cause. If prostate cancer is identified, surgery, radiation, or hormone therapy may address the root problem by shrinking or removing the tumor. For men dealing with lingering incontinence after treatment, solutions may include pelvic floor exercises, Kegels, bladder training, medications, or surgical options such as slings or artificial urinary sphincters. Lifestyle measures like limiting caffeine and alcohol can also help reduce urgency. Loss of bladder control is not just a part of getting older. When it develops suddenly, worsens over time, or occurs with other urinary symptoms, it could signal prostate cancer. Don't wait. Speak with your doctor. Early diagnosis can protect both your dignity and your health. Sign number 10. Painful ejaculation. For many men, intimacy should be enjoyable and fulfilling. But when ejaculation becomes painful, it can be both physically distressing and emotionally alarming. While occasional discomfort may result from infection or inflammation, persistent or recurring pain during ejaculation can signal prostate cancer. The prostate gland and seminal vesicles are directly involved in producing seminal fluid. When cancer enlarges the prostate or invades surrounding tissues, it can cause inflammation, pressure, or nerve irritation. This leads to discomfort ranging from a sharp burning sensation in the penis to a dull ache in the testes, pelvis, rectum, or lower abdomen. Unlike temporary infections that resolve with antibiotics, cancer-related painful ejaculation persists and often worsens over time. Risk factors heighten the concern. Men over age 50, those with a family history of prostate cancer, obesity, or a history of chronic prostatitis face higher risks. African American men who have higher rates of aggressive prostate cancer should be especially alert to this symptom. For diagnosis, doctors typically start with a PSA blood test and a digital rectal exam, DRE, to evaluate the prostate. If concerns arise, further testing may include semen analysis to rule out infection, MRI scans to detect abnormal growth, and a biopsy if cancer is strongly suspected. These tests help distinguish between benign conditions like prostatitis and more serious causes such as prostate cancer. Treatment depends on the underlying diagnosis. If prostate cancer is confirmed, surgery or radiation therapy may be recommended to remove or shrink the tumor. For advanced cases, hormone therapy or chemotherapy may be necessary to slow cancer progression. Supportive treatments such as pain management, anti-inflammatory medications, and counseling can help address both physical discomfort and emotional impact. Painful ejaculation is not something to ignore or be embarrassed about. While men may avoid talking about it, this symptom can be a crucial early warning sign of prostate cancer. If intimacy brings pain instead of pleasure, seek medical evaluation immediately. Early action may not only restore your quality of life, but also protect your future health. Prostate cancer is often called a silent disease because its early symptoms can be subtle, confusing, or mistaken for normal aging. But as we've seen, the warning signs, whether it's painful urination, blood in the urine, persistent back pain, or even changes during intimacy, are your body's way of sounding the alarm. Ignoring them can allow the disease to advance quietly, making treatment harder and outcomes more serious. The good news is that prostate cancer is highly treatable when caught early, with survival rates above 95%. That's why awareness, regular checkups, and timely medical action are absolutely vital. If you or someone you love is experiencing any of these symptoms, don't wait. Schedule a consultation with your doctor today. If this video was helpful, please like, share, and subscribe to spread the message. Together, we can raise awareness, encourage early detection, and help save lives.